In this video, we're going to talk about the first glenohumeral accessory motion, which is, if this is the ball and socket, which is posterior translation. So we want to get the head of that humerus to sit further back. So how do we do this? We have a little bit of an extensive setup, but it's not too bad once you get the hang of it. So the first thing we want to do is block or stabilize the scapula so that it doesn't move in this motion. So we're going to lift up the leg. Juliana, perfect. And then roll to your right. Good. And then lift that knee up. Nice. Roll to the right again. We want to get that belt to go underneath that sacrum. And then from here, we can have her just kind of straighten her right leg out. And that just puts a little bit of pressure on that scapula. We don't want to produce any like nervy tension, nervy tingling or numbness down the arm at all. And we don't want it to be excessively pulling on her neck either. It's just to kind of stabilize that there. Okay. Next thing we need is this half foam roller. It is going to go underneath her elbow. So that way her humerus is basically midline of her trunk, which just helps to keep that neutral. And you can see here how the head of her humerus is wanting to sit a bit forward. We want the ability for that to sit relatively down like that so that the rotator cuff can do its job a little bit better. All right. The other thing that I'll say as far as setup is we have her angled on the table so that her shoulder's kind of actually hanging off the side of the table. And you'll see why as I get her further set up. Okay, so I'm looking at the total length of this belt and I want it to be at its longest point a little bit like 3-4 inches off the floor because I'm going to loop my foot through the bottom of this belt. Okay, so lift up here. I'm going to bring the belt all the way as close to the joint line as I can. All right, now the belt is hanging down and I'm putting my foot on that belt there, and I'm keeping that as close to the joint line as I can so I can get a relative anterior to posterior translation on that humeral head. Okay, and then you just always want to check with your client. Is that okay? You know, sometimes the pressure on the belt can compress nerves, in which case you might want to put some Dicem or a towel to create a little bit of a buffer so that you're not creating any kind of numbness, tingling, nervy kind of symptoms. Okay, so I'm taking up the slack there. All right. Another thing that I can consider doing here, instead of just using the belt, is I can actually do some soft tissue work on that glenohumeral joint line just below the acromion right there. Now, Juliana, go ahead and engage your elbow down into the foam roll. Is that okay? Mm-hmm. And let it go. Good. I'm just kind of feeling what area, what tissue doesn't want to allow the head of that humerus to glide posteriorly. And again. Good. And let it go. And you just continue going here until basically it was not improving anymore, or you feel like you get a springy infill into that motion. Another way to do this that's a little bit quicker but a little less control is to just do the posterior glide through the thenar eminence right here, and I'm kind of pulling her arm away as I'm doing that posterior glide, and then she can press her elbow straight down and let it go. So it's kind of the same thing to try and get that to sit back. And then let's say that we have it where we want to be, and now we want to re-educate. So I'm keeping that head posterior. Feel my fingers on the back of your shoulder. Try to keep the head of the humerus back into my fingers. So keep it back. Keep it back. Don't let me lift you up towards the ceiling. There you go. Good. Now she's kicking in nicely there. So now we're actually retraining those external rotators of the posterior rotator cuff to keep the head of the humerus back where we just improved the motion to. Keep it there. Now I'm going to take away my help for the arm, and I want her to keep her arm in this position without letting the humeral head come forward. Make a fist with your hand. Good, and keep that back. Don't let me push you down. So now we have kind of a cantilever going on here where her posterior rotator cuff is keeping the head of the humerus back, but yet we're turning on her biceps and anterior deltoid in the front, and then we could progress to a combination of isotonics, punch up towards the ceiling. Good, keep that back. I don't want her to lose that posterior translation and slowly let it go down on the way up or on the way back down. Good, 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 and relax. And basically, we would want her to be able to work through a full range of up to about 90 degrees with keeping that posterior translation of the head of the humerus. And then we will have cleared out the posterior translation portion of the glenohumeral accessory motions.